But there's a more important issue, especially for a Monday, and it's about your health and it's about your heart and it's about something that you don't know if it's really good for you or not. So I've enlisted the heart disease specialist, Dr. Robert Edmonson, to join us this morning. Doctor, how are you, sir?
I'm doing well. I don't have a good joke, but I'm doing well.
No, well, you know what? You're not required. You've got better things for us than a good joke. You have important information because for years, doctor, we've been hearing chocolate is good for your heart. Is it? Can it help us? Please straighten us out.
Well, yes, chocolate is good for our cardiovascular system. It's the flavonoids in the chocolate that are beneficial and improve the health of what's called the endothelium, the lining of our blood vessels.
Yeah.
And so it is helpful to a modest degree, and it has the side effects with the other issues about the carbohydrates and sugar. But I think is important, and that people need to realize is that many things that we pass to the grocery store are good for our health. Chocolate we like, so that resonates better. But all the fruits and vegetables, they do the same thing. There's so many things that we do that prevent heart disease, and there's so many things that cause it, aggravate that endothelial health I mentioned, like the saturated fats that we love. That doesn't make the headlines. So chocolate, yes, is beneficial, but there's so many other things that are more so, and it's important to understand all the issues that improve our health.
Well, yeah, I agree with you, and we have to be wise and smart, and all of those tasty, delicious treats in moderation. But now they're saying that when folks have an irregular heartbeat or atrial fibrillation, if I'm getting that right, that they found that chocolate might prevent some of that too?
Yes, they did. And I think that's important to get out there, just so people become more knowledgeable about atrial fibrillation. I think in that study, it wasn't a controlled study, and so it's not one that would be published in the highest level scientific literature, but it's worthwhile to be aware of that. But many other things promote atrial fibrillation. I think they said it reduced it about 20% in the proper amounts. That leaves 80% with atrial fibrillation. So it's important to understand that obesity, all the factors that affect cardiovascular disease, sleep apnea is a major issue with atrial fibrillation, hypertension. There's so many other areas that are important, I think, to get the idea of atrial fibrillation out there, and then for people to start looking at it and critically about what can I do to prevent that. Chocolate has a modest effect, and it's there in the proper amounts. But again, the caveat that there are issues associated with many other things protect from atrial fibrillation, which are critically important.
Well, you're so right. But getting us to talk about it is the most important thing, and these are health risks that we'll more than often put our heads in the sand and we'll avoid it. So Dr. Edmonson, I appreciate you jumping in on a Monday morning to talk to us about this very important topic. Have a great rest of your day, sir.
Thank you. I'm glad to be there.
Thank you. So a little chocolate can be helpful.